Hello everybody, so welcome to our latest video. We got asked by a lady who came in. She'd had really bad back pain, struggling, all kinds of problems. And now she's doing that well, that she is getting back to nursing college. She's training to be a nurse, she's happy, she's excited. She even got engaged. In fact, we discussed it on one of our videos we made last week. But then came another problem that she told us about. And this lady said to me, well, the thing is, my son, and her son I think he's about 5 or 6 or 7, I've not really met him yet. She said to me, well, I'm a bit concerned about my son because he's mentioned his low back a few times. And I thought to myself, oh, he's probably just copying me, you know, he's watching me have problems. And I thought, is he just copying me? And it's true that sometimes children, we have had it happen a couple of times, where children are saying that they've got a problem with their neck or the back, and it's because they're identifying with the mum or dad, and it's because a lot of children look up to the mum and dad, they mimic them, they copy them, so they copy almost everything that they do. And I've got a 2.5-year-old daughter. In fact, she's not 2.5, she's 2.25, and I'm learning, and my wife is finding out that our baby girl is copying a lot of things I do. So it's a really, really important question, because this particular lady was saying, well, how do I know whether or not my little boy is copying me and there's nothing wrong with him? And then it gets you thinking, if a child copies an adult with a health problem, can they develop it? Bit of a deep question on a rainy day in Wigan, but it's a valid question. And the other question is, how do I know if the problem is the person or the child copying me, or how do I know if they've genuinely got a problem? So there's usually 3 tests that you can do, and one of the tests is if the child's copying what the parent is doing, the other parent will notice things that they're copying, but when the other parent's not around, if the child starts not doing things like they'd normally do. So let's say we're talking about a little boy who's watched his dad having back problems, and he's watched his dad struggling to get out of a chair. If that little boy's copying them, it might be that he's just copying. But if you notice that he doesn't want to play his favourite games, or if you notice that he's getting in and out of a chair a bit difficultly, or he's walking oddly, if you see him having traits that you've not seen in his dad, that could be a telltale sign that he's genuinely got a problem going on. And then the next test, and the mums are brilliant at this, the next test is if your child is saying they've got a similar problem to an adult in the house. As a parent, you almost always have a gut feeling, and sometimes when we're busy we forget about that. I'm only 42, but I remember when I was little, people used to act on gut feelings a lot more. And nowadays, there's a lot of science, there's a lot of tests you can have done for any health problem, and I'm not convinced we rely on it as much as we used to do. But most parents, most mums, we get mums bringing the kids in because they'll say, well, my kid has said my back hurts and I can't bend down at school to put my shoes on and get things out of a tray. And other people are saying there can't be anything wrong because she's only 6 or he's only 5. And they're saying, but my gut feeling is there's something wrong. I think that's amazing. I think that's a very valuable test. The test we do in-house is within 2 minutes, by checking somebody's spine or checking somebody's body, I'll know whether or not they've got a problem going on or whether or not they're copying the example of somebody around them. So, that all being said, it's actually quite common for kids to develop problems with the spine. In fact, it's too common, and when you think about it, like you'll think about many causes, and one can be children can be at desks for several hours a day at school. You know, a lot of children are only getting 1 or 2 hours actual PE a week, not even that. And then they're at the desk for the rest of the time. So if you think about it, we all know from our lockdown experience that being at a desk can affect our neck, our back, and that affects our posture, it affects our brain, it affects our nerves, it affects our mood, it affects our immune system, it affects our heart. So if it can happen in adults, it can definitely happen in children. The difference is with children, because they're younger, they've not been building layer upon layer upon layer upon layer upon layer of problem. like a lot of our grown-ups have that come to us. So with children, just desks is one thing. Another thing can be rough and tumble in the playground. So when they are getting some sport, a lot of kids, they play football, they play tick rugby, they fall over, they bump into each other. And that's all fairly normal. It's just that when kids are doing it day in, day out, it can develop problems with the necks, with the backs, and with the nerves. So again, when children come into us with the parents, and that's something we're seeing parents do all the time now, once we check them, we know within a couple of minutes whether or not they've got a problem going on, or whether or not it's more just that they're worried and they're identifying with a parent by copying them. So I guess the biggest point of the whole video is that children, if they are building up a problem with the back, the neck, the nerves, it's a lot better to have that looked at when they're little, because I guarantee every adult I've ever met coming through the door, even if they've only had pain for 2 or 3 weeks, so when I think about the adults we meet that come in here in agony, that problem will have begun in childhood. It'll have begun with things like learning to walk, learning to crawl, learning to hold the head up, school desks, school bags, sports, then the office, maybe university before that. So if you're in any doubt, what you can always do is ring up, and we've got a team who will chat to anybody over the phone, and normally they're pretty good at explaining things to people to give them just a clearer understanding of what might be going on. We don't talk about it a lot, but at any point people can ring up and we just jump on the phone and we explain. Once somebody's explained what's going on with themselves or with somebody in the household, usually at that point we've got a good idea of whether or not there's a problem, and we've also got a good idea of whether or not we could help. So guys, thanks for tuning in today's video. We've looked at some checks and tests that you can do at home if you're wondering if your child has got a neck problem, a back problem, a postural problem, or if they're copying the parents or not. We've covered some tests in the first half of the video, and we've just looked at why children and their spines and their nerves, it's just as important to get them checked and have a checkup from time to time, like you do with the dentists, like you do with the opticians, as it is for us grown-ups. So guys, thank you for tuning in. Thanks for sharing your time by coming watching the video. I appreciate it. Thank you for everybody who comes here as a patient and makes our chiropractic hospital possible. And for me and all the team, have a good afternoon. See you soon. Bye-bye for now.